I will be the second person.
No, no need. I think Elizabeth has to assign Matthew as co-host.
Okay.
I can only assign as host.
You can. You should be able to assign as co-host as well.
Yeah, Matthew is host now.
Am I the host?
Yeah, that's what it says on mine. Matthew is the host now.
Okay, good. Thanks. All right.
By the way, we are live streaming.
Yes. Okay.
All the best.
All right.
Already.
Good luck.
You too, everyone.
Pauline, are you ready?
Depends on how many people. I mean, if there are only a handful, we can delay a couple of minutes lah.
Okay, can I suggest, Elizabeth, you do the screen sharing for the poster so that people know that they've come in on the right screen, and we all just keep quiet for a while. Yeah. Okay, and then yeah. Hi, good evening, everyone. Welcome. My name is Dr. Pauline Lai, and I will be your chairperson today. Welcome to our webinar which is organized by the Catholic Pharmacists Association of Malaysia. This is actually our very first webinar that we are organizing, and our topic for today is actually based on stroke, where there is light at the end of the tunnel. Now, today we actually have three very interesting speakers. They have very interesting topics to present. So without further ado, I would like to introduce our very first speaker. Mr. Sunny Chi is working as a general manager at the National Heart Association of Malaysia since 2012. And as the general manager, he oversees its day-to-day operations. He is also the executive secretary for the ASEAN Federation of Cardiology. So he is very well versed in actually talking to you about what stroke is all about and to provide you an overview. So without much ado, let me hand it over to Sunny.
Hi, thanks, Pauline, for the kind introduction. Just give me a minute to share the slides with everybody. Hang on. Okay. All right. Slides okay? Everyone can see, yeah?
Yes, Sunny, all good.
Yeah, great. Okay. Good evening, ladies and gentlemen. It's wonderful that you all can join us, the Catholic Pharmacists Association, for a webinar this evening. Our topic is about stroke, and let me share with you on this serious medical condition. I will cover these 6 items about stroke in the next few slides to give you an overview of what is stroke, the burden of stroke, signs of stroke, the effects of stroke, the treatment used in stroke, and finally also, very importantly, reducing the risk of stroke. Right, so what is a stroke? When it happens in the heart, we refer to it as heart attack. And when it happens in the brain, instead of brain attack, we actually call it a stroke. So stroke or cerebrovascular disease occurs when blood vessels carrying oxygen and nutrients to the brain is either blocked by a clot or there is actually a blood vessel that bursts. So when that happens, part of the brain cannot get the blood supply and oxygen that it needs for normal functioning. As a result, the brain cells suffer and start to die. So in stroke, the extent and location of the brain cell damage determines the severity of the stroke. It can range from minimal all the way to catastrophic. Because of different areas of the brain controls different functions, the specific effects of a particular stroke actually depends a lot on which area the brain is injured, where the injury happens. A small stroke in a critical area of the brain could still leave a very permanent disability. Now, there are 2 main types of strokes which occur: ischemic and hemorrhagic stroke. Ischemic stroke is the most common in Malaysia, and it occurs in about 2 out of every 3 cases of strokes. In ischemic stroke, this is caused by blood clot, which disrupts blood supply to the brain. So it's a result of blockages, and the supply of blood cannot flow through. Whereas hemorrhagic stroke occurs when there is a artery or blood vessel in the brain which ruptures or causes leakage. So in this case, the leak of the blood that goes into the brain will increase pressure in the brain, especially on the brain cells, and thereby resulting in damages to the brain cells. Let me share with you about the burden of stroke in Malaysia. From the statistics that have been collected and published, 52,000 cases of stroke occur annually. So this breaks down to, in a day, 92 cases are admitted into hospitals for stroke. And this was statistics from 2016. Stroke patients are fairly young. 40% actually aged below 60 years old. And another fact would be 32 deaths are attributed to strokes each day. As you can imagine, a lot of money is spent on stroke, on treating stroke, because of the large number of cases and because of the large number of admissions into hospitals. This is also interesting. 3 out of 10 are stroke survivors, able to carry on with independent living. So in stroke patients, 3 out of 10 would be able to discharge from hospital to be completely independent with good outcomes. But on the other hand, you can imagine there are the other 7 patients out of 10 who have disabilities. So 5 to 6 of them would require some form of assistance for daily activity due to the effect of their stroke, whether it's physical or sometimes cognitive disability. And then you have the other 2 out of 10 stroke patients who have severe disabilities when they are discharged from hospital. So as you can imagine, and I'm sure you know of people with stroke, who have survived stroke and who are living post-stroke with varying degrees of disability after their condition. Just to share some statistics, some further statistics. In Malaysia, this is comparing 2009 and 2019, so a 10-year difference. Stroke was in 2009 the second highest number of deaths related to this disease. In 2019, it has now taken 3rd position. However, over the 10-year period, the increase has been a 38% increase in the number of strokes. So this is relating to death. But if we also look at disability, in terms of disability and death together, strokes rank number 2. And again, as I showed in the earlier slide, the number has increased over the 10 years, over 30% increase in the occurrences. So it is very serious, and this not only it causes death and fatality, but also the disabilities are related to stroke, and it's a problem for patients and also caregivers. This is important to know. the signs of strokes. The acronym is BFAST, right? So BFAST are the signs to look out for to recognize the stroke signs. B would be balance difficulties. So someone who's experiencing stroke usually has dizziness as a common symptom, imbalance. E, the second sign would be eyesight. There will be blurred vision or difficulty focusing. So that is another sign of stroke. Obvious as well would be face drooping, F. In this case, sometimes it could be subtle, sometimes could be very obvious, and it could be only one side of the face causing a droop. The next sign to look out for, arm weakness, A. Arm weaknesses are felt. It could be one arm, both arms, but it is a common symptom in stroke victims. S stands for speech slurring. So there is a degree of speech impediment that happens. And finally, the last acronym T, it's time to call 999 for emergency services to get to a hospital or medical facility as soon as possible. So remember this acronym BFAST, which are the signs, the symptoms, signs of stroke to look out for. What are the effects of stroke? We've just mentioned the signs. So what are the effects of that? Our brain has two hemispheres or two sides, left brain and right brain. So when a stroke happens, as I mentioned earlier, it's where it occurs in the brain, where the injury occurs in the brain is important and determines what is the injury or what is the effect. So in the left brain, if the stroke occurs there, the right side of the body is affected, producing some or all of the following effects. Paralysis on the right side of the body, speech problems or impediments, individual behaviors become slow and cautious. It depends on severity again, and typically there is memory loss. For strokes which occur in the right brain, the left side of the body will be affected, and the effects produced could be one or all of the following: paralysis on the left side of the body. There will be vision problems, so eyesight will be affected. For individuals, behavior is quick and overcautious, so it's different from normal, becomes very overly curious behavior. So yeah, it's definitely the opposite of what happens on the left brain. And again, there will be memory loss as an effect. How about treatments available for stroke? There are several treatments, and I'll just give a quick overview of treatments for stroke. To begin with, how to treat the stroke depends on which type of stroke, whether it's an ischemic or a hemorrhagic stroke. Let's start with ischemic stroke. Ischemic strokes can be treated with clot dissolving medicine or clot busting drugs. The earlier the treatment, the better the outcome. The effect of the clot busting drug is to break up the clot, right? And certain procedures can also be done, called endovascular procedures. This is where it's like an angioplasty, whereby a wire is put into the blood vessel, and the attempt is to remove the clot mechanically. So extracting the clot out from the large vessel occlusion. So generally, if the blood vessel is quite large, this procedure can be done. The doctors will use something like a wire cage device. It's called a stent retriever. So once they go into the site where the clot is, they can remove the clot using suction and physically remove the clot. When this happens also, clot busting drugs will also be given to clear up whatever remnants of the clot is in the brain. In terms of hemorrhagic strokes, as if you recall, it was a situation where there's a leak, or in fact the blood vessel bursts. So it requires surgical treatment. The surgeon will have to make incisions and go in and repair this leak, this damage to the vessel. So generally, these are the treatment options available. And in general, again, getting to a hospital as soon as possible is very important towards the successful treatment of stroke. The outcome, the quicker procedure is done, the better. What can we do to reduce the risk of getting a stroke? So prevention, of course, is always better than cure. And in this case, what are the risk factors? I think this is something that we should discuss. Age is certainly one risk factor. The older you are, the risk of developing strokes is higher. Depends on your medical condition, pre-existing medical conditions. Things like if you already have hypertension, diabetes, high cholesterol, atrial fibrillation, you are at higher risk of developing strokes. Lifestyle factors or modifiable risks, such as smoking, obesity, poor diet, having unhealthy food, high salt, high fat food, these also put you at risk of developing strokes. These other two factors, ethnicity, family history, again, quite related. Ethnicity, certain groups of people tend to have a genetic makeup which make them at higher risk of developing strokes. In particular, research has shown that people who are of South Asian, so Indian, Pakistani, Bangladeshi, Nepalese, Sri Lankan, they tend to have a higher risk, as well as African and Caribbean people in terms of ethnicity. Family history is also an important risk factor. So if an individual has a parent or a sibling who has had a stroke previously, then that individual's risk of stroke is higher. What's interesting is if you look at all the 5 icons here, it's only this one, lifestyle factors, which we can do something about, the modifiable risk factor. We can stop smoking, we can reduce weight, we can eat healthy, better diets. So this is what's always referred to as modifiable risk factors. Whereas the others, we can't do anything about it. So in order to reduce the risk for stroke, as mentioned, as I just mentioned, what can we do? The modifiable risk factors are, of course, having a better diet, eating well, eating better, low-fat diet, high-fiber diet, more fruits and vegetables, and of course, moderation and avoiding the high-fat content and the bad diets that we are more used to, that we love. It's always finding the moderation. Exercise is crucial. At least 150 minutes of aerobic activity, so weekly. So be it walking briskly, cycling, running, whatever that is suitable to your ability. But the guide is 150 minutes of exercise a week. So if you break that up into daily, it's only about 20 minutes a day. Stop smoking is really a first step for everyone who's a smoker. It's not just to reduce the risk of strokes, but also cardiovascular diseases like heart attacks, even other non-communicable diseases like cancers. Certainly, the risk when you reduce, or not only reduce, but when you stop smoking, will come down dramatically. Cutting down on alcohol, moderation in terms of alcohol intake is also important. A general guide is 14 units of alcohol a week, and that is spread out over a period of the week of 7 days, and not at one go 14 units of alcohol. So I think this is my last slide already. I thank you very much for your kind attention. I shall pass the floor back to our chairperson, Pauline.
Hi, thank you, Sunny, for your presentation and the overall view of stroke. Just wanted to remind our audience that if you have any questions that you want to ask, you can post it on the live chat in YouTube, and we will answer it after all three speakers have actually gone and presented their talk. So moving on to the next speaker. Matthew is a retired pharmacist. Before he retired, he was the Regional Consumer and Regulatory Affairs Director with a multinational company dealing with medical devices and skincare and consumer products for over 18 years. Outside his work, Matthew and his wife Serena prepares couples for marriages and gives a lot of talks regarding natural family planning. Matthew will be sharing his personal experience with stroke, and this is his personal story. So please welcome Matthew.
Sorry, give me a second. Okay, yeah. Hi, thank you, Dr. Pauline Lai, for your kind introduction and for letting me share my personal experience. Give me a second. What is happening? Okay, okay. Thank you, Dr. Pauline Lai, for your kind introduction and for letting me share my personal experience with stroke. There are different types of stroke, as mentioned by Sunny earlier, and the severity depends on how widespread the damaged area is. I suffer from a rare cerebellar stroke, which occurs in less than 10% of cases. And this stroke is due to the blockage of the blood supply to the lower brain area. It can potentially be fatal if left untreated. The function of the lower brain is to coordinate muscle movement to maintain posture and balance. It can easily be mistaken for vertigo, as the symptoms are similar, such as dizziness, nausea, vomiting, headache, and double vision. So my neurologist, through MRA or magnetic resonance angiography, confirmed that I had suffered a cerebellar stroke. I had just celebrated my 60th birthday in the company of family and friends who have contributed greatly to the happiness and fulfillment in my life. However, 4 months later, I suffered my stroke. It was in the early hours of the morning when my head started spinning. I felt nauseous and I started vomiting and I could not stand up. The ambulance drove me to the emergency department of the hospital nearby. The importance of caregivers to stroke patients cannot be overstated, as they are totally dependent on them for everything. Not just physical care like feeding, bathing, toiletries, changing clothes, but also emotional support like listening, creative and stimulating activities, love, care, and the time given. Over the years, I've seen my mother-in-law and the many stroke victims descend from healthy individuals to finally succumbing to it, and how utterly they are dependent on their caregivers. I felt totally depressed, frustrated, angry, full of despair, and even embarrassment. During the early stages of my stroke, I suffered the embarrassment of having accidents in bowel movements and having someone to clean up the mess after me. I'm truly grateful to my wife and my siblings for putting up with my negative emotions, but at the same time being there for me. With this gloomy outlook, I felt like being in a long and dark tunnel with no end in sight. I can truly understand how individuals can sometimes feel even suicidal when they suffer a stroke. I was angry with God, and I even questioned him. Why? Why did it happen to me? As you know, we have been preparing couples for marriages and teaching natural family planning for more than 20 years. What more should I be doing? But within a short period of time, 3 close friends died, one after another. A 60-year-old, a 54-year-old, and then a 33-year-old. And this message from God played in my head. Would you prefer to be buried or to be cremated? I should be thankful, and I'm indeed grateful to be alive. I had retired early, and without commuting and working, there should be less stress. Coupled with my regular exercise, healthy food intake and supplements, I was also a non-smoker. Why? Why did it happen? Why did stroke happen to me? My neurologist replied with the following question. Are you 60 years old and above? I said, yes. Do you have family history? Yes, my dad passed away at the age of 42 after several heart attacks, and my grandmother had suffered a stroke before she died. Do you have high blood pressure? Yes, I do. Do you have high cholesterol levels? Yes, I have. Are you a diabetic? Yes, I'm on metformin. Are you obese? Yes, I weigh 84 kilos when I suffered my attack. There you are, Matthew, she replied. You have just confirmed all the risk factors for stroke. And so I started my long journey in the tunnel with no end in sight. I had to learn how to stand, how to transfer my weight so that I can walk with some assistance. After a few days of being in the hospital, our muscles start to weaken. And I started simple exercises of strengthening my core muscles. I was introduced to different machines to build up my calves and my thigh muscles. But being bedridden, I was definitely not a happy camper. After being stabilized in the hospital for about 13 days, I was finally discharged and given medicine and told to come regularly for physiotherapy. So the medication included higher doses of antihypertensive to lower the blood pressure, higher doses of anti-diabetic to lower blood sugar, cholesterol-lowering statins and supplements. Additionally, I was put on antiplatelets, as these medicines are needed to prevent clots to happen and thereby secondary strokes. The doctor also prescribed a traditional Chinese medicine, or TCM, which has been reported to stimulate repair. Because after a stroke, certain areas of the brain have been damaged. However, nerve or neural networks nearby can be repaired and restructured to perform the tasks of the damaged and dead tissues. A month after my stroke, I started to learn how to climb up and to climb down the stairs, learn how to use a walking frame and treadmills with weight to build more muscles and more quickly. I was encouraged by my fellow Billings Ovulation Method teacher to come and help teach couples on natural family planning. I'm quite sure that I was more of a nuisance and hindrance than help, as they had to wheel me around every now and then. However, I think this has greatly helped me to see the light at the end of my dark tunnel and to unlock my passion once more for this ministry of serving others. With higher doses of medication, I felt sleepy and tired throughout the day and was more active when the medications were lower in the evening. By nighttime, I was wide awake as the medications were very low. It was then I discussed with my doctor to space out my medicine from once daily, everything in the morning, to twice daily, one in the morning, one at night, half in the morning, half at night. Otherwise, I would have felt drugged throughout the day, and at night, I had to take a sleeping tablet to help me to sleep. By splitting the dosage, it had definitely improved my quality of life, and there will be sufficient quantities of medicine to prevent a second stroke in the early hours of the morning. A few days later, I was taught to use a walking stick and to learn how to navigate obstacles such as wooden blocks along the way, basically teaching my brain to learn how to coordinate my movements again. More hurdles to overcome, walking sideways, and bending and balancing to touch objects, movement that will help me to lead a normal life. After 8 weeks, I could finally walk without assistance from anyone or any devices like walking stick or a wheelchair. I was then recommended to go for acupuncture. Now, acupuncture has been used in China for thousands of years, but being Western trained, this was not included in our pharmacy curriculum. Fortunately, my neurologist did not discourage me to go for this treatment. The acupuncture practitioner was surprised that I came only after 2 months, as the golden period of using acupuncture is 2 weeks after a stroke had happened. With any treatment, there is the possibility of side effects. Even pinpricks, such as acupuncture needles, can cause internal bleeding, as antiplatelet medicine will delay the blood to clot. And my doctor reduced the dosage of Coplavix to Plavix alone. A month after 3 times weekly session, I was able to drive. I am now more independent in moving around. At 10 weeks, I improved by leaps and bounds. All treatments, medication, physiotherapy, acupuncture, exercises, but especially adequate sleep, contribute to my improvement, as after damage has occurred in the brain is quickly trying to repair itself to lead a normal life. The physiotherapist then started sensory and brain stimulation exercises using different surfaces on bare feet. I felt very unstable on foam, artificial grass carpets, but more stable on hard floors. But when I'm walking on cobblestones, I became like a drunken man swaying here and there as my brain has to relearn this sensory stimulation. Here in this video clip, you can see how unstable I am when stepping on foam surfaces, all right? So as it's not so stable in this sensory perception, it goes back to the brain saying, not stable, I'm going to fall. And this is exactly what happened here. And in the second video, I actually had to learn how to move pegs from a lower to a higher level, and then the reverse, while at the same time balancing myself. So the brain has to learn again how to do these mundane things which we had taken for granted all these years. I noticed something interesting. While exercising in the house, I had the treadmill and watching a movie at the same time, my vision became clearer and the subtitles became sharper as I exercised along. However, after my exercise session and continuing to watch the movie while sitting down, the vision became blurry again and double vision came back. So improvement can easily regress when we are lazy and no longer stimulating our brain. Now I try learning new things, like typing the keyboards of a computer, like giving talks via Zoom, like doing online payment, and even playing computer games like Heyday on the tablet. It lends to the maxim, use it or you will lose it. I'm also thankful for the many prayers, concerns, support, love, and care from all the relatives and friends who have encouraged me to reach this stage after 10 weeks. Thanksgiving celebrations are not enough to repay for all their care and support throughout my recovery. Even 1 year after my stroke, we have to continually push boundaries to maintain our healthy lifestyle. Here you see me fishing at the Kelong and passing on my experiences to young children to enjoy the hobby, playing mahjong with relatives, enjoying a durian feast at a friend's plantation. My wife and I started traveling nearby to Kuching, then to Bali, and then further to Russia and the Baltic countries. In summary, we have to constantly push boundaries so that the brain can continue to improve and to live out our lives, like the Christmas gathering with immediate family members. In Vietnam, traveling around in a small van on a boat cruise, enjoying fellowship with relatives and friends before the pandemic locked us down in March 2020. Thank you, everyone, for listening to my journey from utter despair, depression, and frustration to joy and happiness of being alive and back to my normal activities. So whenever I hear of someone who have suffered a stroke, I would encourage them and tell them there is life after a stroke. I would like to thank everyone, especially our Father in heaven and my wife, Serena, who have helped me to recover from this life-changing event. Thank you and God bless. Stay safe, everyone.
Thank you, Matthew, for that wonderful sharing. It is indeed wonderful to see you fully recovered. I remember visiting you in the hospital as soon as we heard that you had a stroke, and you look so different from that day to today. So wonderful to have you back with us and to really actually hear your personal experience from being a stroke patient and to be fully recovered. Okay, let's move on to our third speaker. Our third speaker is Sunita, Miss Sunita Raj. She is the Senior Principal Assistant Director with the Center of Product and Cosmetic Evaluation in the National Pharmaceutical Regulatory Agency. So basically, in short, what Sunita does is she registers products that has to be used in Malaysia. Her topic is on the use of antiplatelets in the management of stroke. So over to you, Sunita.
Thank you, Dr. Pauline Lai. Very good evening to everyone. Let me just share my screen. Okay. I believe everyone can see my slides. So this evening, I'll be talking about the use of antiplatelet therapy in managing stroke. The contents of my presentation will be starting off with what are antiplatelets, the different types of antiplatelets available in the market, the common side effects, what we can do and what we cannot do while taking antiplatelets, and then a short summary, a take-home message. So to start, what are antiplatelets? So what are antiplatelets? Antiplatelets are medicines that stop cells in the blood, platelets, from sticking together and forming a clot. A blood clot can lead to a heart attack or a stroke. Okay. So platelets are small cell particles found in your blood. When you get a cut, platelets rush to the wound. They become sticky. They bind together to form a clump, and then that helps to stop the bleeding. But this stickiness can also lead to blood clots, clogged arteries, heart attack, or a stroke. So antiplatelets work by making your blood less sticky. So there are different types of antiplatelets in the market. So some of the common ones are Casprin is the brand name. The generic name will be aspirin. So I'm sure some of you are familiar with this. This is how it looks like. The next one will be Cardiprin. Cardiprin also contains aspirin, but it's together with glycerin. Ticlin, the generic name will be ticlopidine. Plavix, as some of you heard just now, that you mentioned about this. The generic name is clopidogrel. And the next one will be Brilinta, generic name Tigaclor. So these are some of the examples of antiplatelets that are available in the market. So let's move to aspirin. Aspirin is the most common antiplatelet to be used. Studies have shown that there's a 25% risk reduction of stroke in patients who are taking aspirin. Aspirin is used as first line for stroke that is caused by a blood clot that did not originate from the heart. Usually, it is recommended to be started within 48 hours of a stroke onset. The usual dose is about 75 milligrams to 100 milligrams orally with food. So aspirin should be taken with or straight after a meal or a snack. This will help reduce any risk of stomach irritation. So the common side effects of aspirin will be gastrointestinal irritation, nausea, and vomiting. This is how aspirin comes. So Cardiprin, as I mentioned earlier, also contains aspirin. So there's 100 milligrams of aspirin and glycerin, 45 milligrams in one tablet. So the usual dose is one tablet to be taken with food or immediately after food. It can also be dissolved on the tongue. So with Cardiprin, there's lesser GI side effects, lesser stomach irritations. So this is how Cardiprin comes like. The next antiplatelet that we'll be talking about will be clopidogrel. So this is a newer derivative. So it's a newer class of antiplatelets. It is more beneficial than aspirin in patients who have contraindication or adverse effects to aspirin, or in patients who are high risk with multiple risk factors such as having previous stroke, they have peripheral artery disease, symptomatic coronary disease, and diabetes. So patients who cannot tolerate or cannot take aspirin, they have more beneficial to take clopidogrel. So the usual dose of clopidogrel will be 75 milligrams once daily with food. Its common side effects, as compared to aspirin, clopidogrel causes slightly higher frequency of rash and diarrhea, and a slightly lower frequency of a stomach upset and gastrointestinal bleeding. So, in some cases, aspirin and clopidogrel are used together for the first 21 to 90 days after an ischemic stroke. We have all heard what an ischemic stroke is from Sunny's presentation earlier. So in this kind of therapy where it's using two, it's called a dual antiplatelet therapy, otherwise abbreviated as DAPT. So after 21 to 90 days, only one antiplatelet medication is continued because this combination is no more effective from preventing another stroke. So this combination of using aspirin and clopidogrel together is only used in high-risk patients who have experienced stroke recurrence despite taking single therapy. All right. Sorry for that. So the next antiplatelet that we'll be talking about will be ticlopidin. It's in the same group as clopidogrel, so it's a newer class. It is slightly more superior to aspirin. And one of the most common side effects of ticlopidin is the lowering of white blood cell count, otherwise called neutropenia. So because of this lowering of white blood cell count, blood monitoring, a baseline full blood count is usually recommended and is usually performed every 2 to 3 weeks because severe neutropenia usually occurs within the first 3 months. So in these cases, people who are on ticlopidin, usually baseline blood count monitoring is done. Okay, so the dose of ticlopidin is usually 250 milligrams orally twice a day with meals. The next one, Ticagrelor. It's in a class called, as I've mentioned, cyclopentyltriazopyrimidines. It's a newer class as well. Usually there's a loading dose for this. Loading dose means it starts with a higher dose first. So it starts with a loading dose of 180 milligrams. That means you're taking 2 tablets of the 90 milligrams as shown in the picture. And then for the maintenance dose, it's 90 milligrams taken together with low dose aspirin. So the first loading dose will be 2 tablets, and then after that, a maintenance dose of 90 milligrams. So when I'm talking about low dose aspirin, it is 75 to 150 milligrams of aspirin, again, with or without food. So Ticagrelor has a risk of increasing bleeding, breathing difficulties, dyspnea, increased risk of uric acid, and increased risk of kidney damage. So what are the common side effects of antiplatelets? Now that we have seen the different types of antiplatelets, what are the common side effects of antiplatelets? Bruising more easily. Bruising can happen not so severe to severe. So as you can see in the diagram, some of them are not as bad, some is really severe. We can also have bleeding for longer if you cut yourself. You can also bleed from the gums when you're brushing your teeth, so you need to be careful. You can have upset stomach, heavier periods for the ladies, or even nosebleeds. It can again be severe to not so severe. So all these are common side effects with antiplatelets that we need to be aware about and be careful about. However, if you have the following side effects that I'm going to be talking about, then you need to seek medical help immediately. If you have blood in your urine, it may not be so obvious, but if you do notice, it's important to seek medical help. You can also have blood in your stools. Severe to may not be so severe. You can also cough up blood, vomiting blood, a hematoma, which is a large bruise that forms a lump, or ringing in your ears. People describe ringing in your ears as hearing sounds that come from inside the body. So usually described as ringing in your ear. So if you have any of these side effects or any of these symptoms, it is best to seek medical advice, medical help immediately. So what can we do? What should we do while taking antiplatelets? It is always important to take your antiplatelet and not to skip a dose. However, if you forget to take your dose, take it immediately when you remember, then continue with the following dose the next day. But if it's almost time for you to take your next dose, skip the missed dose and continue as normal. In the sense, if you're supposed to take your antiplatelet medications every morning, and when you remember it's already evening, forget the dose, take it the next morning. As I've shown you, you need to be alert of your body if you do get hurt or cut yourself. Bleeding can also happen while brushing your teeth, so use a soft toothbrush. If you have to shave, use an electric razor. You also need to be careful about activities that can cause bruising or bleeding. So while taking antiplatelets, it's always important to remember the name of your active ingredient. So like I've mentioned in my second slide, you have brand name and again generic name. So the active ingredient name will be your generic name. You need to inform the dentist when you go for a visit, as sometimes some of the treatments will require you to stop taking your medication. It's also important to inform doctors and healthcare professionals when going for procedures, such as surgery, a daycare surgery or appointment, or even a gastroesophageal scope, as you may be required to stop taking your medication 1 week before the procedure. Do not assume that because you're going to a hospital, it is known. So it's always important to inform your doctor or healthcare professionals that you are on antiplatelet medication. So what are things that you should not do? Do not take a double dose. Too much antiplatelet medication in your body may increase the risk of bleeding and change the levels in your blood. You cannot stop taking your medication. So now what about taking pain medication while taking antiplatelets? Do not take anti-steroidal anti-inflammatory drugs, NSAIDs, like mefamic acid, otherwise known as Ponstan, or ibuprofen, brand name as Nurofen, because these medications can increase the risk of bleeding. However, you can take paracetamol, but if paracetamol cannot help you with the pain, it is best to see a doctor. You cannot take aspirin because not only is aspirin as an antiplatelet, but aspirin also has other effects. Aspirin is also an analgesic. It has anti-inflammatory and antipyretic properties. It is indicated for the relief of mild to moderate pain, such as headache, dysmenorrhea, myalgia, and dental pain. It is also used in the management of pain and inflammation. So it can also be used for diseases like chronic or acute rheumatoid arthritis. So I mentioned antipyretic properties. That will be to help with minor febrile conditions such as fever, cold, and also to relieve headaches. So it is always important to not buy or take any NSAIDs while taking aspirin as an antiplatelet. So what about other medications? Do not stop or start taking any medication or any supplements without talking to your doctor first or your pharmacist. Always ask your healthcare provider before changing your medication or changing your supplements. Certain medication and supplements can cause bleeding and can cause your antiplatelets to not work properly. So it's always important to speak to your healthcare professionals, to speak to your doctors and pharmacists before buying or taking new medication or supplements. So with that, this will be my last take-home slide. So what are the important things to remember? We have looked at what are antiplatelets. So antiplatelets are medication used to prevent platelets or cells from sticking together to form a blood clot. There are a few types of antiplatelet that are commonly used. We have gone through a few of them. It's always important to remember the name and dose of your antiplatelets. It's also important to take your medication at the same time each day, with or without food, as prescribed by your as dispensed by your pharmacist. However, if you have any bleeding that will not stop, it is always important to seek medical attention. Also, you have to inform any healthcare professionals or dentists when you're seeking medical treatment, such as a visit to a dental visit, or if you're going for a daycare appointments. Last but not least, if you can, the pain control medication will be paracetamol. If you cannot tolerate it, it's best to see your doctor to discuss. With that, thank you very much.
Thank you, Sunita, for that enlightening presentation. Okay, I would like to now go to the question and answer section, because we have a couple of questions that have been posted on the live chat in YouTube. Let me just read out to you. Stephen has asked for Sunny slides, and I think we should be able to send it to you. So if you can just provide us your email address, I think that shouldn't be a problem, isn't it, Sunny?
Yeah, no issue.
Yeah, okay. Second question is, does excessive fluid in the brain contributes to stroke? Sunny, would you like to answer that?
Okay, I'll try and answer this. As far as I know, excessive fluid in the brain is hydrocephalus, and it will cause extra pressure on the brain. But I don't think it will cause a stroke. It's the other way. In fact, when a stroke happens, if it's hemorrhagic stroke, blood gets into the brain, there's more fluid, there's more pressure, and damage is done that way. So it's the reversal case rather than stroke causing the damage, and rather than this excessive fluid in the brain causing the stroke.
Yeah, just to add on to that, yes, excessive fluid in the brain is called hydrocephalus, and if it puts pressure on the brain, it can damage it. So it has to be treated, because if it's left treated, hydrocephalus is fatal. So it does not go away on its own. So it's usually due to the accumulation of cerebrospinal fluid in the cavities deep within the brain. So it has really nothing to do with stroke, but the bad effect of it is on the brain. Yeah, okay. I hope we've answered your question, Stephen. Another question also from Stephen is that my dad suffered stroke last week, and the right side of his body, together with his ability to speak and swallow, is affected. Can endovascular procedure reverse or improve paralysis of limb?
Endovascular procedure needs to be done within the window period 6 to 24 hours of the stroke. So if it's happened longer than that, I don't think such procedures would be suitable.
Okay, thank you, Sunny. We've got two comments basically for Matthew. One's from Michael Junim again, the other one's from Stephen. It's well done, Matthew Chong. There is light at the end of the tunnel. In your case, God bless. And from Stephen is you're an inspiration, Matthew Chong. Well done. Matthew, would you want to comment anything? You're muted.
Thanks, Pauline, and thanks for the kind comments. I am just trying to survive. I'm just trying to live. So, I'm just so thankful to be alive and to be able to do what I've been doing all before I had my attack. So, the message I would like to just pass on to others is, don't give up, because I've seen a lot of people, when they struggle to even talk, after a while, it's too much effort, it's too much of burden to their family members, their loved ones, and then they just give up. So I hope that the presentation encourages people not to give up and to live actually. But then again, I'm thinking it's not just for stroke, it's for everything. Nowadays with pandemic, with other illnesses and all that, we shouldn't feel depressed of being locked down and all that sort of thing. So enjoy your life and keep on trying to learn and do things and so on. That's what living is all about. Okay. I don't know whether that answered the question, Prof.
Could I perhaps ask you a question, Matthew?
Yeah.
What would you advise caregivers who are looking after their loved ones who have suffered a stroke?
That is a very good question. Now that I've been on the other side of the fence, I think the most important is understanding. If the caregivers can understand that their loved ones is in this dark, gloomy outlook in life, and if you understand your spouse, then you can learn how to make the decision to love the person, be patient, to be kind, to be empathetic, to so many things. And then once that happens, then you can learn to be more creative, to encourage people, these stroke patients, they struggle with their handicap and all that. So just walking, just talking, just performing simple tasks is to encourage them so that they see some light at the tunnel. If not, then they might as well move on to the next phase after life. So I think we should encourage one another to live and to journey, to face whatever comes, whatever. It's not easy, and I think their faith will be really paramount to make their recovery more to strive towards recovery. Thanks. Does it help the question?
Yes, thank you, Matthew. I think one last question. It can be for Sunny or Sunita. Can I take aspirin to prevent stroke?
Sunny, do you want me to take it?
Yeah, go ahead, Sunita. Go ahead.
Yes. Yes, aspirin can be taken. It's the most common antiplatelet to be prescribed for stroke. So yes, the answer to the question will be yes.
No, Sunita, this is
To prevent stroke?
prophylactic. This is prophylactic treatment.
Oh.
That means the person has not had stroke. So he wants to know whether he can take aspirin to prevent a stroke.
I just venture my 2 cents worth. I think aspirin by itself has so many functions and has got lots of side effects if you take it on a long-term basis. So I wouldn't encourage them, because who knows who is going to get a stroke. You may have risk factors, but if you are doing what Sunny suggests, exercise, eating healthily, and all that, you may not succumb to be a stroke victim. But to take aspirin, I think it will have a long-term effect. This is just my take on it. So I don't know. What about you, Sunny? What do you think?
I wouldn't start it on my own. I think if you are someone, it depends on the individuals and what you have been advised, especially by your doctors. If your risk factors are high, you have multiple risk factors, and aspirin is prescribed to you, then it should be continued. Yeah, but do not start any long-term medication without any professional advice. That would be my take on it.
Yeah, so I agree with that. So that means if it's prescribed to you by your doctor to prevent stroke, yes. So that means, again, it can be used to prevent, but it depends on what the doctor has prescribed you with. If he feels there's a need to start taking aspirin.
Thank you for your
it's
answer.
not just for strokes, but also for prevention of cardiovascular diseases like heart attacks. It is prescribed and used commonly for patients with higher risk.
Yeah, just to add on to that, the side effect of aspirin is actually gastrointestinal side effects. And also because it actually prevents the blood from clotting, if used long-term, it will make you bruise more easily, like what Sunita's presentation is as well. So just a note of caution is aspirin should be prescribed by a doctor and not just be taken on your own. Okay. I think with that, we can call our webinar to a close. The people in the audience in YouTube, you all have been a fantastic audience. You all have participated, listened to us, and given us your feedback. With this, I would like to thank our speakers for their wonderful presentation and for the audience for taking your time out to listen to us today. Thank you very much, and God bless. Good night.
Okay,
Good
thank
night.
you. Good night, everyone.
Good night.
We don't have to leave yet. I think
Are we off?
no, it's still live on YouTube.
Okay, then.
We can wait for Elizabeth to turn off the streaming, right?
Elizabeth?
Yeah, just to add on to that, the side effect of aspirin is actually gastrointestinal side effects.
Can we just
And
leave first?
also because it actually
Okay, all right.
prevents the blood from clotting, if used long-term, it will make you bruise more easily, like what Sunita's presentation is